One of the most common concerns after abdominoplasty is when will I be able to stand straight again? In the early period after abdominoplasty, it is very normal to be slightly bent at the waist. And this is because the abdominal wall is not just tightened horizontally, but is also tightened vertically. As a result, it is completely normal to feel a little bent over in the first 1 to 2 weeks while your body adjusts to that new tension. In addition, if muscle repair has been performed, the abdominal wall will feel tighter again, which also contributes to that early posture. In general, patients gradually straighten over the first couple of weeks, and I would expect all of my patients to be standing straight around 2 to 3 weeks after surgery. At the clinic plastic surgery, I also use quilting sutures, which means the skin wound itself is not under a great deal of tension. In most cases, the main limiting factor of you standing fully upright early on is the tighter abdominal wall rather than the skin tension. During your hospital stay, you are guided on how to move, how to get in and out of bed, and how to walk in a way that supports comfort and protects your muscle repair. It's never been about forcing yourself to walk upright too early. It's always been about allowing your posture to improve gradually as healing progresses. If you're considering abdominoplasty surgery, a personalised consultation allows us to discuss both the procedure itself and what your recovery will look like in a practical, day-to-day way.